Good afternoon, everyone. I'm Madeline Milka. I'm the president and CEO of APAICS, the Asian Pacific American Institute for Congressional Studies. Thank you for joining us today for our APAICS in Conversation. We have joining us Dr. Leana Wen, who is a visiting professor of health policy and management at the George Washington University Milken Institute School of Public Health. Formerly, she was the Commissioner of Health for the City of Baltimore and the former President and CEO of Planned Parenthood. And for those who don't know, in 2019, Dr. Wen was named one of Time Magazine's 100 most influential people. And it is great to have you today on our APAICS in Conversation program, Dr. Wen.
Thank you so much. Thank you for having me. And I just wanted to also introduce baby Isabel, who is my guest today. She is 2.5 weeks old. And I think for all of us, we're all working from home, hopefully sheltering in place for those of us who can to practice social distancing. And so I'm practicing what I preach with having the baby join us today. But thank you for hosting this call.
Oh, it's our pleasure. And Isabel, welcome to the APAICS family. We are honored to have you join us. For those who don't know, can you talk a little bit about your story, about how you actually started in public health?
Sure, absolutely. So I am an emergency physician by training and went into working in the ER because I saw what happens when people go without access to care. And I mean, I came to the US as an immigrant. My parents and I came just before I turned 8. And I was raised in communities where, I saw people around me go without care. I mean, I remember actually when I was little, watching a neighborhood child die in front of me because he had an asthma attack. And his grandmother was too afraid to call for help because they were undocumented. And she didn't know what would happen if she called for assistance. And it's those deeply ingrained experiences that taught me about the importance of healthcare as a fundamental human right, and also about public health, because as we're seeing now with coronavirus, it's that systematic disinvestment in the public's health that gets us into trouble in times that we really need such an investment. I mean, we have just systematically not invested in communities of color, immigrant communities. There are longstanding racial disparities, health disparities that got us to where we are. And now we're seeing the effects of that play out on the global scale. And so I started out working in the ER, and then, as you mentioned, had the privilege of serving as the health commissioner for the City of Baltimore, and so oversaw our public health system here in Baltimore, Maryland. And I'm now honored to be teaching public health and educating students, medical students, nursing students, public health students about the importance of public health and how public health, there's a saying that public health saved your life today, you just don't know it. And I think now we're seeing why public health is so important, and why that investment all along is critical for everyone, not only our most vulnerable communities, but everyone in our society.
Thank you for sharing that with us. It is more than ever in this time period that public health has become the forefront, when we see doctors and nurses and our other medical care professionals out there. So, thank you for sharing your knowledge so that we can continue in a more positive path with public health. Physical distancing measures can sometimes lead to social distancing. What tips do you have for those who are feeling lonely?
Yeah, I mean, I first want to acknowledge just how difficult this time has been for everyone. I mean, the social distancing measures are critical because they are the one instrument that we have. When we don't have a vaccine, we don't have a treatment for COVID-19. And because this is a new disease, no one has immunity to it. And so we need that social distancing in order to stop and at least slow down the rate of transmission of this deadly disease. So we need that social distancing to happen. But it's also caused just huge societal disruption in a way that we could not have imagined just a few months ago. I mean, kids are not going to school, people are not going to work, the unemployment rate is through the roof. I mean, people are making huge sacrifices in order to save the lives of their fellow community members, which is so commendable and so important, but also so challenging. And you're right that the social distancing has resulted or can result in people feeling emotionally disconnected. And I know that for me, as a new mom, I mean, the postpartum period is one that's, for example, pretty challenging and can already feel very isolating. And for so many people, we're used to having friends and relatives come and see our new baby, or in other circumstances, come and take care of young children or older adults who now don't have people stopping in to see them. I mean, nursing homes are not even allowing visitors, many of them. Patients going to hospitals may not be able to have a visitor accompany them. And so the change in social norms is something that's profound throughout society. I think we need to keep in mind that physical distancing, social distancing should not mean social isolation. And in fact, we have to do even more, much more, to do outreach to those who are particularly vulnerable. For older adults who may not know, may not be as comfortable with technology, for individuals who may not have the tech resources, we need to help them get there so that they can still continue to communicate. Even for people who are introverts at heart, it's easy to go through days or even weeks without communicating with anyone now. And I would highly encourage for everyone who can to go outside and exercise, to get some fresh air, because that's also important to our mental and emotional well-being, and to make the plan to stay connected to other individuals, whether it's through Zoom or replacing face-to-face time with FaceTime or Skype, that we just have to set up these regular methods of communicating to one another so as to not have the emotional toll really overwhelm us at this time when we're making some huge sacrifices in our daily lives.
So what I'm hearing is, think about getting some fresh air, obviously social, physical distancing and that, getting some exercise, what about nutrition and health, and that regard for eating. Some of that is also an issue because of the grocery stores also putting in those social distancing measures. What other things would you also recommend in terms of improving wellness?
That's a really good point about overall wellness. First, I mean, wellness is so important for a whole number of reasons, including during the times of COVID-19. We know that people who have underlying medical conditions are more predisposed to having severe effects of COVID-19. And so the better we're able to optimize our health, the more we're able to be protected against COVID-19, or at least the severe effects of it. And the other thing too is we know that many of our doctors' offices have scaled down their operations. And so it's harder than normal to get healthcare. And so again, the more you can optimize your health, the better. So a few tips. One is look at your existing medical conditions and do your best as much as you can to optimize these. What I mean is for high blood pressure or diabetes, sometimes we may let up on our medication regimens or on exercise or diet. Now is the time to really optimize our health as much as we can. Talk to your doctor about telemedicine, about other ways that they are replacing your normal medical care, and make sure to make those appointments as you can. And then if you're a smoker, if you use e-cigarettes or vape, I mean, I know that nicotine is highly addictive, but of all times to quit smoking and to quit vaping and e-cigarettes, now is that time, because that lung injury also predisposes people to COVID-19 as well. And you mentioned overall wellness. I recognize the difficulties at this time when we are trying to reduce our risk factors and reduce the number of times we're going to the grocery store. But now is also a good time to make lists, plan ahead. So maybe you used to go to the grocery store 3 times a week. Reduce it to once a week or once every 2 weeks to minimize your exposure. But you can still make a list and try to eat healthier now that we're eating in potentially more as well and not going out for fast foods. Now is the time to, as my family has, we've been doing a lot more cooking, a lot of trying out new recipes. And I think that healthy eating is also a habit that we can begin to build at this time as well.
Thank you for sharing those tips. As a reminder to everyone who is watching, please feel free to put your questions in the comments section, and we will get to them towards the end of our conversation. So please place your questions in the comment section. Thank you so much for having Isabel join us. We're excited to meet her. There are so many fears surrounding COVID-19, and none felt more closely than those who are currently pregnant or have recently given birth, such as yourself. Can you talk a little bit about your experience? Because you were doing it just as this was all sort of happening and playing out.
That's right. Well, I mean, I never anticipated that I would be pregnant and giving birth in the middle of a pandemic. I mean, that's something that, of all the planning, and I'm a serial planner as an ER doctor, I think about all the things that could possibly go wrong. But no way could we have anticipated this as a challenge that we'd be going through. I mean, we know that pregnancy is already a time that's filled with a lot of uncertainties. I have a son who's 2.5 years old, and I just remember when I gave birth to him 2.5 years ago, I had very different concerns on my mind. I mean, there were a lot of different concerns. It was, should I get an epidural? What would labor induction be like? What kind of car seat should I be getting? What would breastfeeding be like? I mean, even those were time consuming and just difficult to think through. Well, this time it was totally different. In my last month of pregnancy was when everything began happening in terms of hospitals being concerned that they were going to be over capacity. And I just remember from one OB visit to the next, the hospital guidelines changed completely. It used to be that my hospital where I gave birth to my son and to Isabel, it used to be that they welcomed everyone in the labor and delivery unit to visit the baby and to see, to be with the mom in the time of pregnancy. Well, those guidelines changed completely so that from one week to the next, I wasn't allowed a visitor for my routine visits. And then the hospital began having no visitors at all, except for beginning of life and end of life. Thankfully, I was able to have my husband there with me during the labor delivery process. But for a moment, we thought that perhaps that might not be possible because there are other hospitals in the country that had a policy of no visitors. Understandable as to why, but how challenging is that? And again, something that we would not have necessarily envisioned before. And then, of course, there's all this uncertainty too. I mean, I've had nightmares about what happens if I had symptoms of COVID and I would not be allowed to touch my baby for potentially weeks or a month. There's still uncertainty about whether a pregnant person can transmit COVID to the fetus. So far, it does not look, based on studies, that there is maternal fetal transmission. There is no virus that's found in amniotic fluid or in breast milk, but there's still an open question about this. And also, we don't know about the effects of COVID-19 on the first and second trimester, just because this hasn't been around for long enough. And so I think there are so many unknowns at a time that's already filled with uncertainty. And I would recommend for pregnant people to, again, come up with a plan, knowing that the plan will change. This is the time to ask your OB, your midwife, et cetera, about how many prenatal visits do you really need in person? Can you switch to telemedicine? What is the hospital policy? How can you keep abreast of that policy? What is the best way for you to reduce your own risk? So perhaps you as a pregnant person doesn't go to the grocery store yourself. You ask someone else, a partner, a family member, et cetera, to go for you instead. Understanding that this is a time of great uncertainty added on top of existing uncertainties too.
With such a normally joyous occasion, how does one work through the mental process also of going through this, and then not just, let's say, for instance, having a new family member join you. It's also young people who should be experiencing a milestone such as graduation, proms, like another milestone in their lives. How do you best advise people on trying to accept, the moment that isn't happening, but yet also experience some joy out of the moment that they are passing through another life passage?
That's such a good way of phrasing it. I think the one side of it, I think there are a couple ways to think about it. One of it is adjusting our expectations. Knowing that what we might have imagined as the milestone for years, whether it's having a child or getting married or graduation or prom, that it's not going to look like what we envision it to be. Now, it might in time, I know of a lot of people who are putting off their various celebrations. Maybe they're getting a marriage license now, but not having the ceremony until later. Or going through, for example, in my case, we're able to, I can't introduce Isabel, who I just fed, so she's going to be burping soon. But I know that I can't be introducing her in person to our relatives and loved ones, but I can introduce her over video, and then in person, maybe in months to come. It might even be a year before my father, for example, is able to meet her, or my husband's mother is able to meet her, because they live so far away and it wouldn't be safe for them to travel. So part of it is adjusting our expectations and changing them to what we're able to accommodate at this time. I think the other part too is recognizing that what we're doing right now is so much bigger than us. That the sacrifices that we're making, yes, it's to keep our families safe and our loved ones safe, but it's also an investment that we're making in our communities and to protect everyone around us. And I think it's a time where we're all in this together, and we're recognizing that our individual sacrifices are what's saving the lives of everyone around us too. And I think that will also help us to get through these challenging times as well.
Thank you. For all those who are watching, please remember to put your questions in the comment section so that we can ask them towards the end of this conversation. The other question that I have for you is based around sort of this, kind of flipped relationship. My mother is in her late 70s. I feel that she has reverted to a teenager because she constantly wants to leave the house, break curfew, as I say it. And I feel that sometimes with our seniors, I'm having a challenging time trying to keep her safe at home. Do you have any words of suggestions for us, older folks who are trying to rail in our parents?
I'm having the same challenge too. My father, who is a very healthy 75-year-old, is constantly saying, well, he's fine. He doesn't have pre-existing conditions, and he wants to be up and about, and he wants to, fly across the country. And, it's a challenge because, these are our parents, as you said. They're not necessarily used to taking advice from their children. I think part of it is just continuing to emphasize the science and the evidence, and to state that we're doing this out of love, that we're making these recommendations not because we want to restrict their freedoms and their independence, but because we really are worried about them. And I think the other part too is making compromises as well. I can't exactly tell my father, who lives in Vancouver, never to leave his house if he wants to go grocery shopping and wants to do it, 3 times a week. That maybe is something that that I encourage him how to do so safely, knowing that he's going to do it anyway. So can he go with a mask? Can he make sure to bring hand sanitizer? Can he make sure to bring wipes? Can we figure out compromises that are safe while also continuing to emphasize the evidence too? For him, traveling, as he has been discussing, is not the best idea. My sister and I have been trying to advise him not to take his cross-country trips to visit us, because frankly, it's not safe for him or us or other people that he's traveling with. But can we make some small compromises and help him be as safe as possible, while recognizing why this is happening too, that it is a question of social isolation and feeling emotionally disconnected that's prompting a lot of this too.
Can you, one of the questions we have from our Facebook audience is, can you please speak to the acts of violence against Asian Pacific Americans as they are being blamed for the pandemic? What are things the APA community can do to address this and support members in our community?
Yeah, this was something that I wish were not happening. It's the whole naming, and I don't want to say, everybody knows what COVID-19 has been called, including by our president and by our public officials. There's a reason why the World Health Organization has a whole committee on naming illnesses, because we don't want to have stigma and racism attached to illnesses that, frankly, even if it originated in one place, we know that diseases know no boundaries, and that, again, we as a world are in this together. So naming it after a group of people, first of all, is inaccurate and also just causes so many harms. And I am really concerned about as you said, just so many acts of racism and violence that have been occurring. I mean, I myself, as someone as a public health expert who's been doing a lot of commenting on this, I've received all kinds of comments about how I should go back to my own country, which, by the way, is the US, as a US citizen. But also all these comments about why should I be commenting on this topic when my people, quote unquote, are the ones that brought this disease into the rest of the world. And so I think that we have to each do our part to speak the truth, to talk as scientists, as public policy officials, as members of the community, to educate. And I think as much as possible to approach the individuals who hold these views with empathy. As hard as that is, I think people in these times are looking for someone to blame. They're looking for the antagonist in this. You know, we are not the antagonist as Asian Americans, of course, but we have to understand where this is coming from, that people are losing their livelihoods. They're listening to misinformation from all kinds of sources that we may not find to be reputable, but to them are the most credible messengers. And so we need to do our part to educate and to approach everyone with empathy and compassion.
A follow-up question to that is, do you know of any public health initiatives that are addressing discrimination and racism against APIAs during this time?
That's a really good question. I'm not sure about public health initiatives. I mean, I know of initiatives by public health entities that are aimed at debunking misinformation, calling COVID-19 the disease for what it is, and naming the virus SARS-CoV-2 because that's what it's literally called. I know of also of health education that's targeted for communities of color, immigrant communities, et cetera, and of course of advocacy efforts that are aimed at, for example, speaking out against the public charge rule and anti-immigrant policies. But I'm not sure about specific public health efforts that are aimed against racism. But clearly, this is an important, a critical effort for us because, again, we're all in this together, and it only will hamper public health if we are to continue to harbor these attitudes that are dangerous.
As we know, May is Asian Pacific American Heritage Month. It is also Mental Health Awareness Month. And there is a stigma attached to mental health within the API community. So I wanted to ask you, what do you suggest in methods in which people can check in on each other, can check in on, especially during this period of isolation, potential isolation, and how that affects our mental health, being that it is Mental Health Awareness Month in May?
Yeah, it's such a good question. And I think there needs to be the recognition among all of us that mental health is just as important as physical health, that these two issues are completely intertwined, and that we have to tend to each other's health, that there's, it's not a matter of stigma and shame in the same way that we don't say to somebody, oh, you have diabetes, you have high blood pressure, let's not talk about it. We should be talking about mental health, depression, anxiety, et cetera, in exactly the same way. I think part of it is sharing our own stories as much as we can. I had, when I had my son 2.5 years ago, I had postpartum depression. And I actually was really ashamed of it. I thought that there was something wrong with me, and I knew that it didn't make any sense, that medically, scientifically, I understood what depression is, why postpartum depression occurs. But when it was myself, I felt this level of shame and stigma that actually prevented me from talking about this for almost a year after. And now looking back, and in general, I'm talking about my own struggle and experience with it as a way to normalize depression, normalize mental health. And I think that all of us sharing our stories where we can, where we feel comfortable with it, is important. And I think the other thing too, as you said, is to also check in on one another. We shouldn't assume that everybody is fine just because we look fine. We should check in on one another, help each other again, so that we don't see this time of physical distancing as emotional as emotional distancing and isolation.
Well, we have a few minutes left, and so I wanted to see if you could answer our last question. What does it mean to be a resilient leader?
Um, a resilient leader is one who is not afraid to admit his vulnerabilities. A resilient leader is one that proceeds recognizing that in order to be bold, in order to do the hard things, that it involves taking risks. And by definition, taking on risks and challenges means that we will fail sometimes, and that we will encounter challenges in our lives that we could not have possibly anticipated, and that not everything is going to work out as we might have expected. But the true strength of that leader, the true strength of our tenacity and our courage, is not how we succeed in times where things are going well. It's how we proceed during these challenging times, how we get past these challenges, these barriers that are in the way, and how do we thrive, not because things are going well, but in times of hardship. And I think these are the times of hardship for everyone right now. And it will call upon all of us to recognize each other's vulnerabilities, to be honest about who we are, and to proceed with urgency, compassion, and action.
Thank you, Dr. Wen, for all of your incredible knowledge and for sharing that with us today. I want to remind folks that this Friday at noon Eastern, APAICS will be hosting Sam O and Cheryl Horry for campaigning in a digital environment. Being that we are in a different world, we are not campaigning as we used to on a one-on-one basis, canvassing, doing all those usual things. And so we wanted to provide some resources to folks. So join us this Friday at noon Eastern. Our next APAICS in conversation will be on April 29th at 12:30 p.m. Eastern with the Honorable Norman Bay. He's the former chairman of the Federal Energy Regulatory Commission, otherwise known as FERC. So please sign up for any of our activities at apaics.org. And I'd like to thank Dr. Wen again and Isabel for joining us today for APAICS in Conversation.
Thank you very much. And thank you for your incredible work and the work of APAICS every single day.
Thank you.